This morning on BRN, eating yogurt regularly may reduce the risk of colon cancer. Joining me now to discuss this and a lot more, Dr. Chris Damman is with the University of Washington. Dr. Damman, great to see you. Thanks for joining us on the program this morning.
Oh, thanks, Jeff, for having me on.
I was joking with you before, I am a big-time Greek yogurt eater. So this research that you and the team performed, it's fascinating to me. But I want to back up and start with the risk of colon cancer. And it seems the incidence of colon cancer seems to be increasing, especially among some of our younger members of our society. I want to get your reaction to that.
Yeah, it is indeed. So we've seen a rising incidence of colorectal cancer in young individuals in particular. And as a result, the current guidelines are actually recommending that screenings start for the general population at 45. Now, that could be a colonoscopy, it could be a stool test, but screening nonetheless is recommended at an earlier age as a result of that march earlier in finding colon cancer. Now, I would say anecdotally, in my practice and the procedures that I do, it's seldom a week that goes that I don't find either cancer or a large advanced polyp on procedures. So I worry a bit that we're really just starting to see the tip of the iceberg. As,
And
you know.
sorry to interrupt you. I was going to ask, is there any, and I'm talking about anecdotally, or any research that would indicate why maybe that incidence of colon cancer, is it the type of food we're consuming, or maybe we're not digesting as well as we used to, maybe? I don't know.
I mean,
Or both.
we can't say with 100% certainty what's driving that, but we do know associations. Association, isn't causation, but it helps begin to figure out what might be contributing. Undoubtedly, it's environmental. So we can say that because the incidence is changing. So genetics certainly play a role, but the fact that there's a rising rate means that there's something in our environment that's changing. And food is probably a big part of it, not the only part. We know that exercise and sleep and stress management and these other things are actually really important for overall health as well. But food is probably contributing disproportionately here. And we do know which foods both, positively associate with cancer, in other words, are linked to higher rates, and other foods which are negatively associated, in other words, foods that may be protective in colon cancer. So we do have some clue of what might be contributing.
But the rule of thumb really is get a test. And I've done both the stool test and the colonoscopy. The technology has come such a far along. I mean, it's not painful at all to do either. One requires a little bit more prep than the other, but if it typically is covered by insurance providers.
Yeah, so there's very little out-of-pocket costs. Might be a copay or something like that for having a screening colonoscopy or screening test done by your primary provider or gastroenterologist. So it's a really good idea. We know that it's rising in rate, and so it can give you, if nothing else, peace of mind and reassurance that your colon is clean of polyps. And at best, it can catch a polyp when it's still in that early stage before it becomes cancer. That's really key. That's why we do the screenings, is to actually prevent those polyps from becoming cancer.
And that's why the research that you and the team and other hospital associations around the country, it's so important to figure out the causation and what we can do about it. Let's talk about the latest research and the relationship to yogurt. Do you want to talk at a very high level what you tested and what type of yogurt maybe works best, I guess, for lack of a better way of phrasing a question?
Yeah, so there's pretty recent research. A number of different studies have come out recently looking at dairy products in general and their association with colorectal cancer. And this adds to our growing understanding of which foods in general are associated. So just briefly, the things that are negatively associated, in other words, contribute possibly to colon cancer, would be things we normally think about. So alcohol, tobacco, and as it turns out, red meat, and in particular, processed red meats. It turns out these processed red meats are actually class one carcinogens. In other words, almost certainly contributing to the rise of colon cancer. So what are these salty meats or preserved meats? Things like bacon and sausage, even deli meats that you'd put on a sandwich. And right now there's, big craze around, these dried beef sticks or beef jerky because they're high in protein and considered to be helpful for, maybe weight loss, but they're class one carcinogens and maybe contributing. So where does yogurt and where do dairy products fit into this? One study showed that dairy products in general and maybe calcium in particular are associated with a decreased risk of colon cancer. And there's actually some good mechanistic understanding of why calcium might be protective. So it's not just yogurt. But there is another study that looked at yogurt in particular and looked at how some of the species that are present in the yogurt, might associate with development or lack thereof of colon cancer. And so there's probably, protective effect of dairy products in general, but, yogurt is one of those dairy products.
And does it matter, Dr. Damon, the type of yogurt? I mean, I was talking before about Greek yogurt, but there are different types of yogurts out there, and it doesn't mean it doesn't matter what brand, but I mean, but the type. Does the type matter? So, is one more healthy towards reducing the risk of colon cancer than the other, or is it equal?
Yeah, no, we don't know that certain types of yogurt are more associated with a lower risk of colon cancer. But again, it's dairy products in general that seem to have that lower risk. But generally for health, the yogurts that are lower in sugar are going to be healthier for you. Um, maybe the ones that are also lower in fat because there's saturated fat in dairy products. Although we're learning that all saturated fat isn't created equal, and the types of saturated fats that come in dairy products may actually be healthier for you than what you'd find in, say, a piece of meat that has saturated fat. It's a completely different profile that the animals are producing in their milk for their offspring.
And Doctor, just to kind of follow through, you already talked about the screening process, how important that is, and needing to do it younger and younger. Can we just reiterate a little bit about the nutritional aspect? You talked about staying away from the slim. I'm going to name them Slim Jims. That was the Macho Man Randy Savage's big pitch. Hot dogs, I think, are in that. So, is it more of a plant-based diet or lean protein like chicken and other types of things that we should maybe focus our diets on, nuts and other legumes?
Yeah, yeah, absolutely. So we know those processed meats, like you're saying, the hot dogs and the preserved sticks are definitely associated. Those are probably, if you're going to avoid animal-based proteins, those would be the things to stay away from the most. The next thing that I would consider would be red meats. And we know when we grill red meat at high temperature, it creates carcinogens. The sort of char that you see, the acylcarnitines is what they're called, have been linked with development of cancer. And even the heme, which is what gives it its color, it's that red color that you see in blood. That also may be associated with increased risk. So it's the red meats in particular. And if you're going to eat proteins, then staying with poultry and fish and leaner meats are going to be better options. And then, if you're interested in plant-based sources of protein, beans are an incredible source. You've got pound per pound more protein there than you'd find, I believe, in an egg or in milk. So great source of protein, but also comes with tons of good fiber and polyphenols and other plant compounds that are beneficial. Nuts as well are a very good source, and seeds are a good source, and they're easy to add to just about anything, a salad or a soup or what have you.
Yeah, and all those things are completely accessible in your local grocery store. You basically have to shop the perimeter, but you get those. And it just sounds to me, doctor, that we just need to keep talking about these issues and why it's so important, and eventually it'll find its way into society. Dr. Damman, we're going to have to leave it there. Thanks so much for joining us. Great research, and we look forward to having you back on the program again very soon, sir.
Wonderful. Thanks for having me, Jeff. Great to chat.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website, and your subscription helps support all this great BRN content. Until tomorrow, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.